Welcome to the lecture on the integration of agility, plyometrics, and reactive drill after ACL reconstruction. I am Major Arun, and today we will focus on how to safely progress patients beyond basic strength and running into the higher demand activities required for the sports. This stage of rehabilitation is critical because while strength may appear symmetrical, neuromuscular deficits and reactive control often persist. Our objective is to combine evidence-based progression strategies with clear functional criteria, ensuring drills improve performance while minimizing injury risk. By the end of this session, you will have a framework to integrate agility, plyometrics, and reactive drills after late-stage ACL rehabilitation. These are the few important learning objectives. Firstly, the objective is to explain the stretch shortening cycle and the reactive strength index and why athletes may still have reactive deficits despite symmetrical hop distance. Secondly, we will define the functional prerequisites for progression, including strength threshold, landing quality, and load tolerance, and how to monitor them. We will apply graded progression strategies that align with the phases of rehabilitation, beginning with controlled landings and progressing to sport-specific reactive drills. Finally, we will evaluate readiness by monitoring risk factors during change of direction tasks, since these are most common situations in which re-injury occurs. Together, these objectives form a roadmap for safe late-stage rehabilitation. ACL injuries are especially common in sports that involve rapid cutting, pivoting movements such as football, basketball, and handball. While ACL reconstruction restores mechanical stability, athletes often still exhibit neuromuscular deficits at the time of return to sports. Agility, plyometrics, and reactive drills are therefore essential to retrain movement quality, restore explosive strength, and improve dynamic stability. These drills simulate the unpredictable high quality demand and high velocity demands of sports, helping athletes transfer their gym-based gains into real performance. Most importantly, they also reduce the risk of re-injury by preparing the athlete for chaotic, unplanned scenarios. Let us define our key terms. Agility involves more than a simple change of direction. It combines speed with ability to respond to external stimuli such as an opponent or a visual cue. Reactive drills are exercises that train the body to efficiently use the stretch shortening cycle with minimal ground contact time, for example, repeated hops or drop jumps. Plyometrics are stretch shortening cycle based drills designed to develop explosive power through rapid eccentric concentric transition. Understanding these definitions clarifies how each component targets different but complementary aspects of late-stage rehabilitation. Few mechanistic rationales. Agility training goes beyond physical drills. It develops perceptual and decision making skills that are critical in competitive play. Reactive drills improve the reactive strength index, which is strongly correlated with efficient landing mechanics and quick change of direction performance. Plyometrics enhance the rate of force development, neuromuscular efficiency, and the ability to control joint stiffness, which together enable explosive yet stable movements. Each component, therefore, has a unique rationale: agility for decision making, reactive drills for rapid force utilization, and plyometrics for explosive outputs. Integrated together, they create holistic approach to restore performance and resilience. Something about post-ACLR deficits. Even when hop test shows symmetrical distance, deeper neuromuscular asymmetries often persists. The reactive strength index may remain reduced, indicating poor utilization of stretch shortening cycle. Change of direction biomechanics are often impaired. Athletes may show reduced knee flexion angles, increased trunk lean, or frontal plane collapses. Altered frontal and transverse plane mechanics place greater strain on the reconstructed ligament and increases the risk of second injury. Therefore, sport clearance based only on strength or hop distance misses these subtle but critical deficits. Plyometric integration during the rehabilitation phases. Low to moderate intensity plyometrics protocols have been shown to improve knee strength, restore range of motion, and enhances functional outcomes after ACL reconstruction. They are superior to traditional resistance training alone for developing power and multidirectional speed. By targeting explosive strength, plyometrics support improvements in running mechanics, sprint performance, and jump quality in later stages of rehabilitation. However, progression must be cautious. Poor landing technique or inadequate strength can make plyometrics harmful. Prerequisites such as single leg landing control and quadriceps symmetry must be satisfied before integration. In a similar manner, agility integration. Agility training must address both physical qualities and technical execution. Strength, reactive strength, posture, and foot placement all influences safe and efficient change of direction performance. Movement quality should be assessed not only by the field test like shuttle runs or t-test, but also by video analysis or 3D motion analysis. Planned change of direction drills teach mechanics in a controlled way, while unplanned drills add the perceptual cognitive element needed for the sport. This combination ensures athletes develop both the technique and the reactivity required for real competition. Finally, the reactive drill integration. Reactive drills can be particularly challenging and therefore require excellent form and close supervision. The goal is to progressively reduce ground contact time, teaching the body to store and release elastic energy more efficiently. Few examples include simple pogo jumps, quick repeated hops, bilateral as well as unilateral, and drop jumps with immediate takeoffs. These drills also improve dynamic balance, proprioception, and neuromuscular coordination under high speed loading. Qualitative assessment, observing knee valgus, trunk lean, or any compensatory strategies is critical to avoid reinforcing faulty patterns. Some of the important prerequisites for integration of these drills. Before introducing these drills, several prerequisites must be met. Clinically, pain should be minimal, efficient, absent or in traces, and full range of motion restoration. Strength and symmetry should exceed 85% of limb symmetric index before plyometrics and 90% before agility or reactive drills. Adequate hip and calf strength are essential for dynamic stability since they control frontal plane mechanics during landings. Finally, the athlete should demonstrate controlled single leg landing, sound drop jump technique, and tolerance to running loads. Skipping these checkpoints risk overload and re-injury. When designing protocols, always match drill intensity to the athlete's strength, movement quality, and the compliance of the training surface. Monitor objective measures like reactive strength index and joint kinematics alongside visual movement assessments. Progress systematically bilateral before unilateral and planned before unplanned drills. Avoid excessive frontal or transverse plane knee loading in the early phases as this is the position most associated with ACL injury risk. The principle is simple. Progress when quality is demonstrated, not when the calendar says so. In phase 1, which begins around 3 to 4 months, the focus is on pre-plyometric preparations. This includes teach safe landing mechanics, alignment cues, and mini hops with emphasis on soft landings. The goal is to ingrain correct motor patterns before adding explosive demand. Athletes must demonstrate symmetrical control in these drills before advancing. Think of this as teaching the body how to absorb force correctly before generating it explosively. In the drop jump, the athletes step off a low box and lands softly with knee flexed and hips in back. Key cues include upright trunk, neutral knee alignment, and shock absorption through the quadriceps. This drill trains safe landing mechanics early in plyometric progression, reducing valgus risk and prepares the graft for higher loads. In phase 2, controlled plyometrics are introduced. These include bilateral drop jumps, split jumps, and low height box landings. The bilateral nature distributes load and provides a safer introduction to higher impact. We carefully monitor landing mechanics, ground contact time, and post landing stability. Only when quality is consistent and effusion is absent, we progress toward unilateral drills. The box jump requires jumping explosively onto a stable platform, landing softly with knees and hips flexed. Correct posture demands trunk control and symmetrical loading. This develops concentric power and controlled eccentric landing, critical for progressing toward sports specific plyometrics. Avoid excessive knee valgus or stiff landings. Double leg plyometrics involve repeated jumps forward, laterally, and diagonally. Key focus is on synchronized takeoff and controlled landings with equal weight distribution on both the legs. This drill enhances multi-directional power and reactive stability, bridging controlled drills with sports-like demands. Monitor fatigue and symmetry between legs closely. Ladder drills emphasize rapid footwork through predefined patterns while maintaining knee alignment and low athletic stance. They improve coordination, rhythm, and neuromuscular speed. Clinically, they reintroduce controlled agility and reactivity, progressing athletes toward multidirectional movement under higher tempo. In phase 3, we progress to unilateral plyometrics and more advanced change of direction drills. Example includes lateral hops, forward hops, and 45-degree cutting drills. This phase specifically challenges single limb control and is essential for sports where most tasks occur off one leg. Reactive demands are higher, so athletes must have strong hip and core stability to prevent compensations. At this stage, tolerance to repeated landings is as important as maximum jump height. This drill focuses on controlled landings from small jumps onto one leg. Athletes must stabilize with upright trunk, soft knee bend, and no valgus collapse. It trains eccentric control, proprioception, and single limb stability. These are all essential before introducing high intensity single leg plyometrics. Cone drills straight at 45-degree and at 60-degree diagonal turns. Cone drills at varied angles train acceleration, deceleration, and controlled directional change. Proper cues include low stance, quick foot pivot, and trunk stability. They progressively expose the knee to multiplanar loads, bridging agility and reactive movement demands seen in competitive sport. Phase 4 begins after 8 months and focuses on sport specific reactive scenarios. Here we introduce unplanned change of direction tasks triggered by visual or auditory cues. This simulates the unpredictable environment of sport where athlete must make split second decision while under load. We continue to monitor mechanics closely, ensuring knee alignment and trunk control are maintained even under fatigue. This phase represents the final bridge to unrestricted return to play. This drill integrates multiple rapid directional cuts in unpredictable sequence. Correct execution requires efficient deceleration, trunk control, and knee stability under load. It replicates high intensity sport situation and tests readiness for return to play. Here, the athlete reacts to a coach's verbal commands, performing sudden cuts, sprints, or directional shifts. The reactive element simulates game like unpredictability. It challenges neuromuscular readiness and decision making alongside movement execution. This dual task drill adds ball catching while performing agility maneuvers. It increases cognitive load and requires simultaneous hand eye coordination with safe knee mechanics. It reflects competitive play demands where focus is divided. These drills combine agility runs with sport specific ball handling or dribbling. They integrate physical, technical, and cognitive skills, bridging rehabilitation with real game performance. Key focus is maintaining trunk and knee control even during complex tasks. Monitoring must be both quantitative and qualitative. Quantitative measures include reactive strength index, hop symmetry or change of direction times, and ground reaction force analysis. Return to play targets include achieving more than 90% limb symmetry and less than reactive strength index deficit compared to the uninvolved limb. Qualitative observation remains essential, watching for trunk lean, knee valgus, and poor foot placement. Integrating both form of monitoring ensures we capture both numbers and movement quality, which together define readiness. Final clearance requires demonstrating sport-specific drills under fatigue without compensatory mechanics. Strength must reach at least 90% symmetry compared to the uninjured side. Reactive strength index and change of direction performance should be close to pre-injury or match to control data. And just as importantly, psychological readiness must be confirmed. Athletes need confidence in their knee to fully commit to movement. Meeting all these criteria together ensures a safe and confident return to competition. In conclusion, agility, plyometrics, and reactive drills are essential components of late-stage ACL rehabilitation. They address residual neuromuscular deficits, improve performance qualities, and reduce re-injury risk when integrated with appropriate manner. Progression must be staged, objective, and aligned with individual prerequisites. By monitoring both quantitative and qualitative markers, we ensure drills build capacity without compromising safety. Ultimately, structured integration of these advanced drills prepares athletes not just to return to sport, but to thrive in it. These recommendations are grounded in both clinical practice guidelines and recent case studies. The ASPETAR 2023 guideline, PUCTOPS clinical commentary, and recent rehabilitation case reports highlight the effectiveness and safety of plyometrics and agility integration. Bruckner and Khan also provide broad foundation for sports medicine principles were applied here. By combining evidence, clinical observation, and athlete-specific factors, we can optimize outcomes for every individual. For optimal recovery, it is essential to follow the rehabilitation exercises in the demonstrated sequence, beginning each session with a structured warm up and concluding with an appropriate cool down. This systematic approach ensures that each step builds on the previous phase, promoting safe, effective, and progressive rehabilitation. Patient videos and images shown in this presentation are used with prior informed consent. Jai Hind.